All right, hey everybody, Nikki Burnett here, Taste Life Nutrition. This is Functional Friday with Gabrielle Grandel. And we're talking about, sorry, just jumping in. And so, yeah, we're talking about SIBO. So, Gabrielle, sorry, since I was so rude and interrupted you, go ahead with what you were saying.
I was just going to say hi to everyone, and my name is Gabrielle Grandel, for those that don't know me. And Nikki and I are both functional nutritionists, and we work together collaborating with clients. I'm here in Texas, and she's in Colorado. And the first Friday every month, we do Functional Friday at 12 o'clock Central Time, 11 o'clock Mountain Time. And so this is a continuation of our talk from last time. SIBO Part 1, this is SIBO Part 2, which is small intestinal bacterial overgrowth. That's what we're talking about.
Yeah, so we've done a lot of talking about gut issues because it's so prevalent, and it's we could probably talk for the entire year about all of the different gut issues and all the things that can go on with us, but we want to try to be as specific as possible. And we chose SIBO last month because it's one of those things that a lot of people haven't heard of. And there are, and it's rampant. I mean, literally it's everywhere. So I think we want to do just a quick recap of a few of the things that we covered last week, what it is, what it means, what it looks like, and then kind of dive into a little bit deeper some of the other stuff that we want to cover. And so some of the things that we talked about last week were, this intense bloating that can happen, and people don't understand what it's coming from, and the fact that it's not normal. Some people just think, well, I guess I just have a distended belly, and it's not true. These things are not normal. We also talked about, the types of different SIBO, right? There's method. I almost combined the two words, methane and hydrogen. Mm-hmm. And so we'll dig into how we figure out which one is which. What were the other things that we covered? The things that can cause SIBO. Mm-hmm. So go ahead if you want to. Yeah, I don't mean to just talk and talk.
Yeah, no, it's okay. So we talked about how digestive function issues can lead to SIBO. So if we have issues with our gallbladder, or if we have not enough hydrochloric acid or stomach acid, for various reasons, maybe we were taking antacids or proton pump inhibitors or things like that. Maybe we were not mindful around our mealtime. And so we, didn't allow for those digestive juices and enzymes to start breaking our food down. We swallowed it almost whole. We didn't really chew it. And so it then sat there and let the bugs kind of come and feed on it. Let's see. Then those are some of the main things that we discussed. Someone could also have motility issues, meaning they don't, they're not having that wave come through to really absorb and metabolize their foods and then excrete what they don't need. And that might be as related to a condition with their thyroid. I don't think we talked a lot about that, but sometimes that's a coordinating, factor to consider.
Also, and a point that you brought up a little while ago is food poisoning. Food poisoning can create enough imbalance that can, just give enough opportunity for SIBO to flare. And what it is, so SIBO itself is not an infection. I think that there is the belief by some that it is an infection. What it actually is our normal gut flora just migrated into the wrong part of the gut. And so they're not supposed to be there. And so they are doing their job, but it's creating pain and wreaking havoc on us. And it's really uncomfortable.
Because essentially they've crawled from the large intestine up into the small intestine, which is supposed to be pretty sterile. And then we eat healthful foods, and those bugs essentially, will get it before we do. And then they ferment it and they produce hydrogen or methane. And so that's what we were referring to earlier about the different types of SIBO that might be common. Really what we hear about a lot of times is, SIBO related with IBS. So you might go to your gastroenterologist, you know, because you've got bloating or diarrhea or constipation or gas or something like that. And they want to do colonoscopy, or, you know, they want to do endoscopy, or they might not do any testing, and they might just say, based on your symptoms, you've got this label of IBS. It's like, great. So what's that? So it's this, you know, kind of umbrella term where IBS-D, IBS-C, which is diarrhea or constipation, or mixed IBS. And what we know from research is that most SIBO, I think it's a good percentage, like 70% or something like that. I'm sorry, most IBS-D is actually as a result of SIBO that never, you know, was looked at or treated.
Yeah. And I think that's you know, it's important to understand that because someone gives you a diagnosis of IBS, IBS is not a diagnosis. Mm-hmm. So one of the things that we talk about, and we talk about all the time, especially so the two of us, and then I think anybody in functional medicine, functional nutrition world, is you always have to ask why. Why do I have IBS? You don't just have IBS. You don't just have rheumatoid arthritis. You don't just have brain fog. There's always something, and you got to find somebody who's going to dig and going to help you dig. And that's what functional medicine and functional nutrition is all about, is really digging as deep as you possibly can to understand why. And just don't stop asking why. I have a good friend of mine. She's a Chinese medical doctor. Mm-hmm. And she's like, it's like the little kid. He's always like, why? And I'm like, it's so true, because that's what we do. It's just never stop asking why. Just be that child and be curious, because there's something there.
Yeah, absolutely. Good point.
I know, I love that. So we were doing a little bit of looking around, and we found, and I think it's a great website, or a great article, blog, whatever, that, you know, any of you might want to check out if you like to, because it's really to the point. And it's by Dr. Jill Carnahan. And so we wanted to read off a couple of things because it's really succinct. And we wanted to talk about, you know, some of the signs and symptoms of SIBO, and then, you know, some of the conditions, which is, there's a whole list of them that could be caused by SIBO. And so if you're okay with it, I'll just start with this signs and symptoms, and
sure,
we'll go from there. So the first one is eating fiber makes your symptoms worse. So when we talk about, and I think we hit on this a little bit last week, if you know SIBO, if you have SIBO, if you've researched SIBO at all, there are these different diets that are supposed to help you to eliminate SIBO. You have to understand that diet itself will not eliminate SIBO. And so these FODMAP is an acronym for all of these different fibers and vegetables and fruits, and they're healthy. But because this bacteria is in the wrong place, then, you know, it's making our body angry, because the bacteria is doing its job, but it's not doing good for us. So FODMAP is more of a diagnostic tool, I think, in practice. And we don't diagnose, but it helps us to understand if you are going low FODMAP, you're eating these foods that don't have high FODMAPs, and you are reacting well to them, helps us to understand that this is probably something that you're dealing with. Okay. Mm-hmm.
Or if you look at the list and you see yourself in that list, that you consume a lot of those foods, you know, on a regular basis, then you'd probably see some value in switching, you know, and not continuing to feed those bugs unknowingly.
Yeah. But also knowing that this is not a long-term solution or even suggestion, because these are healthy foods, and we still need them to feed the other good bugs. So if there's something that is really bothering you, cut it out. But if there are other foods on the list that don't bother you, eat them. And then you want to bring those foods back in as soon as possible. And so we've got 5 minutes. It's so hard to keep this short. But we'll hit on, you know, kind of what we do here in a little bit. So the rest of the signs and symptoms. So your gas and bloating increase when you take probiotics. You eat gluten-free diet, but the symptoms still persist. You suffer from chronic symptoms of gas, bloating, constipation, or diarrhea recently after taking medication, right? So this is, the medication can be what is the culprit to the bugs migrating into the wrong area. You can't shake your brain fog. You're losing weight, but aren't sure why. and your blood work shows chronically low iron or ferritin with no known cause. So those are really important things to look at.
Absolutely.
Cool. All right. So go ahead.
So do you want to talk a little bit about some testing options and how we kind of identify what's going on with folks?
Yeah, sure. I know. So one of the things that we were just, I'm sorry, were you, I was just going to go right ahead. Go ahead. If you were going to say it.
Go ahead.
I didn't mean to jump over you.
No worries.
One of the things that we were talking about was different types of testing and what we do in practice, and practitioners are going to approach different things in different ways. Mm-hmm. There is what's called a SIBO test, and it's a SIBO breath test. Lots of practitioners do use it. And I'm going to tell you that personally, I don't. And if you know me at all, or you'll get to know me, I love testing. Testing gives us so much information. I think it's very, very important. But what we learn, to my knowledge, is it's not as accurate as we want it to be. So if we're to come back a false negative or a false positive, and we go through a program or protocol based on that, then it doesn't really do anybody any good. When I think it's just as effective, or maybe even more effective, to go off your symptoms, do a low FODMAP diet, see if you do well on that, and then start a protocol based on that. I think that's much more effective than spending money on testing that may or may not be accurate.
Yes. So a couple of things to kind of add to that, to your point. A lot of practitioners do use that breath test because they are writing prescriptions that are determined based on whether or not it's a methane dominant situation or a hydrogen dominant situation. That's the only way that you would know through a breath test, because we're measuring those gases. But what I have also found is very helpful, and Nikki, you use this too, is stool testing, because stool testing is so comprehensive, depending which lab you go with, but is so comprehensive at looking at all the different types of microbes in there. It doesn't necessarily tell us which ones are hydrogen producing or methane producing, although we have some evidence, around that. But there's actually even testing that will group, we know so much about this and we're learning so much that it'll group the bacteria into that category of SIBO, meaning that there's a correlation. So if you were to do a test and you had high numbers or an imbalance of those bacteria that tend to be correlated with SIBO, we could sort of extrapolate that you also have SIBO because you also have those correlating bacteria that the population that was surveyed that had SIBO had as well. And then with the stool test, often you can look at other types of inflammation and look at digestive function, which all play a role in why we might have SIBO or how to correct for it. And then we use things like the low FODMAP food plan and antimicrobials, and possibly, replenishment of things like digestive enzymes or hydrochloric acid, depending on what we find, to help our people out. But I do think it's really important to make a point that, like you said, Nikki, that the low FODMAP food plan is not the cure-all, be-all, and it's also not long-term. It's too restrictive to be to be long-term, but it's just used in a therapeutic way. Right.
Agreed. So we're trying to, just so y'all know our strategy here, we're trying to keep these, short and sweet and succinct. And so we are hitting right about 14 minutes now. I think that's maybe a good place to stop. And if we have more that we want to sort of strategize about and talk about for next time, we can, or we'll do something else. It's always a surprise for us too. So.
Yeah. Just stay on the edge of your seat.
Yeah.
And send us any ideas. We're always, open for ideas of what you guys want to hear about, what you want to learn about. That's our whole purpose, is just to help serve you and just to help educate and put together the dots and empower you to be healthy. Yeah.
And keep in mind too, we should have said this in the beginning. We're just getting it together, that this is not medical advice, obviously. We are functional nutritionists. We are not medical doctors and medical practitioners. But we want to do our best to help you educate and find what's right for you, because you're not everybody else. We want you to find your truth, and help you to be healthy, live healthfully, to the best of your ability. And so we just want to give the right information. That's really our goal. And so with that said, if you can post down below. Since we're on Zoom, we can't see any comments or anything, but post your questions down below. You can find us both. You can find me at tastelifenutrition.com is my website. Taste Life Nutrition is the Facebook page. Taste Life Nut is Twitter and Instagram, that kind of thing. I have a free assessment on my website that I'll reach out to you personally and we'll chat about it if you like. And Gabrielle, how about you?
Yeah,
I know where you can be found.
Yeah, Gabrielle Grandel, social media, YouTube. I have some great videos there. My phone number is 972-930-0260. And I'm at livingwelldallas.com is the website. And I also do free phone consultations to figure out if it's a good fit to work together or not.
Absolutely.
So thanks everyone for listening. And we'll see you the first Friday of next month.
Gosh, the year's going by so quick.
I know it. It's going to be September.
Have a good one.
Bye, everyone.